For the bone marrow test of the results, I think I understand the number of blasts that we get. What are the, if I can say it, sideroblasts? It's a word I can barely say and not understand at all.
What do they mean?
What is it? Yes.
Yeah, so very straightforward really. The bone marrow has different kinds of maturing cells, and you know about them. One of them, the most common, is the red cell. It makes the red cells that circulate in your blood. So a precursor, an early cell of the blood that goes on to make a mature blood cell is called a blast. So the early cell that makes red cells is called an erythroblast, because it makes erythroid cells, red cells. Now, quite commonly in MDS, probably in about 15% of patients, those red cells are really quite faultily made, quite mangled as they're made. And red cells contain iron, because that's what traps the oxygen, the hemoglobin. And as that mangled up red cell is being made, the iron that's in that red cell precipitates out. It forms a little granule. It isn't bound by the hemoglobin, it's just sort of, as it were, a lump of iron, if you will, in a red cell. That's called a sideroblast. Okay, sidero, I don't know the Greek derivation for iron, but I suspect it's related to the Greek for iron. So it's an early red cell precursor where the iron has formed a lump. That's a sideroblast. And we can see that in the bone marrow. We can look for it and we can see it. And it's a marker of abnormal red cell maturation. So patients who have that kind of MDS usually don't respond very well to erythropoietin. So some MDS patients, in fact somebody in the audience here, has been on EPO for a long, long time, erythropoietin. Patients with sideroblastic MDS usually respond less well to EPO. Just, I think it's a marker of their red cells being really rather screwed up.